Sporothrix brasiliensis is a dimorphic fungus. Its filamentous form at 25 degrees Celsius, which is about 77 degrees Fahrenheit, and a yeast-like form at 35 to 37 degrees Celsius, which is about 95 to 98.6, which is human body temperature. It is actively spreading in Brazil and to other countries, including Paraguay and Argentina. The pictures you'll see, picture A, um, well, picture A is the fungus grown in culture. Picture B, the middle picture, is the fungus at 400 magnification, stained with cotton blue. And the last picture is an asteroid body, which are characteristic of sporotrichosis. So it largely affects cats. Um, it's spread from cat to cat through fights, or when they groom themselves, they can spread it to their mouths and faces. In humans, it's spread by cat bites or scratches, or by touching the mucous membranes after handling an infected cat. So the symptoms, 90 to 95% of cases are cutaneous. And the upper limbs are most commonly affected because that's usually where cats scratch. Lymphocutaneous sporotrichosis causes painful nodules in a linear fashion along the lymph vessels. Usually starts about 2 to 4 weeks after the trauma. You'll get what's called an inoculation canker, and then it spreads from there. In another 2 weeks, and you have these linear lesions. Then there's also a version called fixed cutaneous sporotrichosis, which you don't have the spreading, you just have the nodular lesion at the site of infection. Then there's also cutaneous disseminated sporotrichosis, which is really nasty. You can see in the picture that it is pretty gnarly. That usually is not as common in people that are immunocompetent. Chronic alcoholism, HIV, AIDS, diabetes, or other immunocompromising conditions can lead to more severe symptoms. So here you'll see picture A is the linear lymphocutaneous version, and also B is lymphocutaneous. C is limited fixed cutaneous, and then the bottom are disseminated. The bottom 3 pictures, those are all 3 immunocompromised patients. This picture here also is of a patient with HIV who has disseminated cutaneous. But there's also extracutaneous effects that can occur, which only occurs in about 5 to 10% of cases, but it is possible. So you can get osteoarthritis, osteolysis, which is the pathological destruction or disappearance of bone tissue. Tenosynovitis is the inflammation of the fluid-filled sheath that surrounds the tendon. So that's really painful. So those are not common complications, but they can happen. So diagnosis is usually, there's a few ways that you can diagnose this disease. So direct microscopy. Something to remember with direct microscopy is that there are several different, as we've learned, Sporothrix bacteria, such as like Rose Gardner's disease, and they all have the same appearance microscopically. They can only be differentiated through genetic or proteomic testing. Then you have immunodiagnostics, so there's an intradermal skin test that has a high sensitivity of 94% and a specificity of 95%, which is pretty good. Then there's also the ELISA method, which is the enzyme-linked immunosorbent assay. You probably learned about it in molecular, but it's useful for detecting antibodies. They've even used it from cerebrospinal fluid. And there's also culture, which is kind of the gold standard. It allows for um, culture allows for antifungal susceptibility testing. So the Sabarod dextrose agar, or SD agar, is used initially because it has a high pH. Um, so that prevents bacterial growth. And then it's transitioned to brain heart infusion agar, which is just a nutrient rich general purpose agar. And the pictures show this is actually not brasiliensis. This is the rose gardener's disease, but they look the same. They look largely similar. So the first two tubes, the one is melanized, the middle one is melanized, the one on the side is not, but they're the same. And then the brain heart infusion agar is used in the last tube, and that is actually cultured at a higher temperature of 37 degrees. So you can see that it's the yeast-like form rather than the filamentous form. Creamy white color, and it usually colonies form after 7 days of growth. And then there's also molecular testing. So there's species specified PCR, so you use specific primers that only amplify a particular sequence in one species. That can be useful, and there's also some sequencing techniques that they use. As a practitioner, it's really important to take a good history and be nosy. You want to know if your patients have handled cats or other wild animals. They've even seen it be transferred through armadillos. So you also want to know if they've traveled to anywhere in Brazil or other surrounding neighboring South American countries. So treatment, itraconazole is the most common treatment. It's given orally for at least 12 months for pulmonary sporotrichosis, which you don't really see as many cases with this particular brasiliensis. But then it's 3 to 6 months of treatment with cutaneous infections. And then they also use potassium iodide. It's an older treatment. It's been used since 1903, but the itraconazole is definitely more common now. Then if you have severe cases, amphotericin B can be given intravenously. It's also what you would want to give in pregnancy. The azoles, so itraconazole, fluconazole, they can be used during pregnancy. So the prognosis is generally good. Majority of patients are cured, and they don't have a recurrence of symptoms. So with the recent outbreaks in Rio de Janeiro, human cases jumped from 759 cases between 1998 to 2004, and more than 4,000 in 2014. And now, in 2017, there were 10,000 cases alone, which are mostly from feline transmission. So here's a map. You can kind of see where the largest burden of the disease is. So some things that can be done to help prevent the disease are to neuter street animals, to treat sick cats, of course, and incinerate dead infected animals. I think people tend to want to bury their animals, and the fungus can grow in the soil, so it's best to incinerate them. And just avoid handling cats in Brazil or neighboring countries. Even if they seem nice, sometimes they can be unpredictable, and I think that's where a lot of the data is showing that people get in trouble with cats. Thank you.